Yeah, so I'm sitting there as a student and I've got this event popping up.
You're at this workshop and you have
I have an event that pops up in my head.
okay, event spontaneously popped up in your head, or did y'all
For
plan
the most part. I
Okay.
mean, there's a script that they followed, and this event popped up in my head. And this event was I'm sitting at the table with my dad. I'm 5 years of age. Okay, in my mind. And I'm maybe 6. And he's yelling at me about not getting this math problem correct. Okay. When I look at that image, it's about an 8 at that moment. Through the processing of eye movements and just continuous, we call it bilateral stimulation, that's eye movements. Through the eye movements of about 20, 30 sets of that, we were able to get it down from that 8 to a 0.
So explain what the other person who is also in training at this class with you.
Yeah.
So you take on the role as the participant, and the other person is taking on the role as the therapist.
Mm-hmm.
And so what is this the person that's taking on the role of the therapist saying to you? Or
I'll tell you what they're saying. They're saying one sentence, 2 sentences.
okay.
The first thing they're saying is, go with that. And what did you notice? And that's it.
Okay.
Healing happened in 2 sentences. They didn't do much. They just sat there, were present with me, showed compassion, empathy, and did bilateral stimulation and used the words, what did you notice? And go with that. 7 things that come to mind.
Did y'all do the finger?
Yep, they did.
Okay, so you didn't have the
no light bars, no buzzers.
Light bars, no special equipment, just the
just
the
our
finger
hands.
movement, and you're following this person
with my eyes
back and forth. Okay. And so you came out of, now how many days was this particular first class?
3 days, full days.
And so you came out of that class that day with what?
I'm doing this. This is what's called trauma-informed care right here.
Okay.
That's trauma-informed care. If someone comes to me and says, what's trauma-informed care? I say, using a modality like EMDR. It's basically a method. Using a method like EMDR or a method like cognitive behavioral therapy that's trauma-focused. That is trauma-informed care. So when you go into an agency and they say we're trauma-informed care, your next question should be, what method are you using?
And then from my perspective, just to explain the type of trauma work that I do is the relationship,
Mm-hmm.
offering the safety,
Mm-hmm.
the connection, and allowing the person, as I said earlier, to tell their story, and that is the development of getting a history, especially in the areas of what major life events have happened over the past 6 months to a year,
Mm-hmm.
to lifetime events from the time you're born. But it's all done in in that, a very systematic, sequential history of problems at school, from the problems at birth all the way to present day, and what happened at school, any major accidents or illnesses, major life events, and people are able to name these on like a timeline without that feeling threatening. It's just telling their story.
Daniel Siegel says it all the time. He said, and this is a psychologist that works with trauma, very well known, an expert. He says, name it to tame it.
Well, and I was going to mention that earlier because in talking about the need that people don't have the ability to name it. And I'm a firm believer in the work that I do of naming it. I don't use that term, but I'm looking forward. Is that directly from the book on the
It's in Whole Brain Child.
Whole Brain Child? Okay.
And it's also called another book called Mindsight.
Okay.
So here's the thing: when trauma happens, in the book Body Keeps the Score, there's a region of the brain. It's on the left side. And that's in Body Keeps the Score, about that region where they did scans on that region. And they found that that's one of the reasons why naming it tame it works, is because it's lighting up that region that fails when trauma happens. And it should fail when trauma happens, because when trauma happens, you need to get out of there, or you need to freeze to stay safe.
Then we learned through working with each other that, well, let's see if this EMDR thing could possibly be of benefit. And EMDR being now somewhat of a buzzword acronym,
Yep.
People,
because I can't walk around and say, hey, did you receive eye movement desensitization reprocessing today?
Okay, now slow that down and say that slow.
That's why we say
EMDR means
eye movement desensitization reprocessing.
right. Okay, and that's Leroy putting.
Yeah.
Leroy, you just love to be on camera. But so that is the technical name.
Go over there right now. Sorry.
No, you don't have to be sorry about Leroy. I love Leroy being in on things. So you went. Let's just continue with this. So
that was the first 3 days. Okay.
Okay.
And then we broke up for about a month. And we came back for another 3 days.
Now, what group were you? Who was doing this class?
Let me think of the. So it gets a little complicated. So who oversees the classes is a group called EMDR. EMDRIA.
Okay.
And
you told me about before.
And yep, and they're kind of responsible for accrediting curriculum and making sure that us as EMDR therapists are receiving the proper training to do EMDR. So I always say, if there's a therapist watching or a therapist talking to me about wanting to be EMDR trained, I always say you need to make sure that it's approved by EMDR. If it's not approved by EMDR, you're not going to be able to be doing EMDR therapy. You're going to get, at some point down the road, you're going to get hit. Somebody, either EMDR is going to approach you and say, what are you doing? Or a client's going to get you, because you're going to mess up somewhere in EMDR, and you're going to have to go to, there might be a lawsuit, and you're going to have to prove your training.
Are they, so is this, this is official in terms of they are the certifying body?
They are the ones who certified EMDR trained therapists.
Okay.
Yeah.
So people going to classes or full day workshops and they come out practicing EMDR.
I'll give you an example. PESI is not a curriculum approved by EMDR.
Okay.
Yeah, and so it's intensive because you meet for the first 3 days.
You've done how many hours now have you? Because it kept growing and
Almost, I have
growing.
at least 3,000, because that's all I do now. Is EMDR. That's the only thing I do.
How many hours of actual? I know that you did a lot.
Oh, when I was
actual classwork, or actual training, because you went for.
It's 60.
Started off with
it's 60
days.
hours.
60 hours. Okay.
While in training.
Okay.
So it's a lot. Within.
And then you continue to do updated training, don't you?
Mm-hmm.
Okay. Which we all have to do. Just
here's the thing: is someone will ask me, well, how does it work? Like, how's it changing the brain? And the answer is, we don't really know. Just like a neurologist doesn't know either. A neurologist knows very little about the brain. Now, I say that he knows a lot about the brain, but very little compared to what's there. Huh?
I said he or she.
Yeah. He or she. Sorry. Like a neurologist, they know a lot, but when it comes to the brain, there's so much involved and so much going on that we don't know. We don't know what's going on.
Well, and that's what Dr. Vanderkolk, who wrote The Body Keeps the Score, said, that it's not completely understood why at this point why it works, and they're working on doing more studies with using EMDR and trauma.
Yep.
So, but the eye movement, well, let's just go back to the beginning. So, or midway, I should say. So you go and you start doing EMDR training. You decide this is something that you really want to do. And I remember when you were coming back into the office saying, I really am interested in this. I really want to pursue this. And you continue to pursue it. And I was, I won't say skeptical. That's not really
That's okay, because I was skeptical at the beginning.
I wasn't really skeptical. I was just like, oh, wait and see. I want to wait and see. Taylor's the guinea pig. Go out and be the guinea pig, Taylor, and then come back and tell me how all of this works. Because the truth of the matter is, a lot of people do not. It was fortunate that you were a student, because a lot of therapists don't have the ability, financially and or time-wise, to take the time off required to go get the training, because it was involving a lot of training.
Any therapist I know has to take at least 2 days, has to take at least 4 days off. Unless you're a therapist that also works Saturday, and then you have to take 6 days off.
Mm-hmm. Yeah. So I saw the time that you were investing become more and more, and I thought, okay, we're gonna see how this goes. And then meanwhile, I'm having clients coming in not really knowing that you are doing training in EMDR, but they have heard about this thing called EMDR. So I'm getting a lot of people coming in, and they're beginning to talk about EMDR in the trauma trainings that I'm doing. And so it's becoming a buzzword. It's becoming as much of a buzzword as CBT has been a buzzword, that or a buzz acronym, I should say. And people were hoping that CBT would be, well, I can go in and I can see a therapist, and if they're doing this thing called CBT, which is cognitive behavioral therapy, that I can get to the source of why I'm feeling so crummy, and we can get this over and done. You know, we can just nip it in the bud. You know, and so I feel like that's a lot of what people are looking for, is a quick fix. And maybe that's the wrong words to use. I mean,
That's what people want. But even then, I tell them,
a quick
someone
method, I should say, in terms of having relief from their pain,
yes,
physical, emotional, or mental pain.
yes,
And so I started talking to people that were interested of, would you, Taylor is about to get certified.
yeah,
Would you like to try doing some EMDR sessions with him? And so we set up a Saturday clinic where people could come in. It was not a paid thing that this was another one of our free services that we offered for people to come in and to give you additional hours in working with people, and then to give them the opportunity and to try EMDR, and to give me the opportunity to be the fly on the wall, although I wasn't right there in the room, but to be present and to be part of the process, to be informed. It was it was quite an adventure.
yeah. And that's me just learning. And I look back even at that, and I think of some of the improvements that I've learned in EMDR. I mean, it's
Oh, I can't imagine, because
like it's refining your craft.
but one thing to sum up, and I know that we're gonna have to get off of here because this is I never know where this is going to take us and which direction we'll go, but this just was a nice path to go down on some of the things that what you doing, Leroy?
He is wanting to play so badly.
He's winning. I think Leroy really enjoys the camera. He
Yeah.
I think he wants to be on camera. But a lot of the people that were coming into this experiment
No.
were coming out with wow. I'll just the wow factor.
Yeah.